I'm Bruce Kessler. I'm a primary care doc who came to Humboldt County in 1978 with my wife, thinking that we'd try this place out for a year and see if it worked for us. And it's been a great place to live and practice. I think one of the things that makes our program special is the partnership between the hospital and Open Door Clinic. We're a small hospital, but we serve as a regional medical center for a very large geographic area. The three-county area that comes here for their medical care encompasses a land area of 10,000 square miles, which is essentially the same as either Vermont or New Hampshire. But we only have 175,000 people. We are the medical center that people are sent to for complicated cases. We have the Level 3 Trauma Center. We're the STEMI Receiving Center for heart attacks. We have the only Level 2 neonatal intensive care unit for 150 miles in any direction. And we also have a regional cancer center. So in training primary care physicians, it gives you the best of both worlds, both in terms of training in a wide variety of patients with different medical conditions that you get by working in a regional medical center, as well as working in a top-notch federal qualified health center using the principles of patient-centered healthcare.
My name is Margot Oliver. I'm a second-year family medicine resident. I came here because I've always wanted to do primary care, worked in an underserved area, and to be in a beautiful location in a community that I love. We're in a rural area, we're unopposed, so that means when we're on OB, we're the residents to be called for OB, or when we're working with the dermatologist, we've got the dermatologist's full focus and enthusiasm. In our clinics, we are into little pods, so we have a couple residents with an attending, and then we have MAs working with us to update health maintenance, and we have a nurse who's helping out with our inboxes and just managing our little patient load together. And it's a lovely atmosphere where everybody is taking care of both each other and everybody's working together to take care of patients.
My name is Dr. May Hong, and I am the Residency Program Director. What attracted me to this residency program was the people that I met and what they are accomplishing out here. I was really excited. Many of the people in the area have complex healthcare needs that haven't been addressed for a long, long time. And so your patient panel will be full of people who need to have their needs addressed fairly quickly. Most of the time when a patient comes in and is introduced to a resident, immediately there are issues that need to be taken care of at that visit. Every visit counts.
My name is Anu Rai. I am a second-year resident, currently partaking in family medicine residency. But Open Door has given us the outpatient experience, which has been incredible. We've get to see plenty of different types of patients. We get to have different experiences. This program has much to offer that others don't when it compared to, let's say, a university setting. Like usually in academic settings, you would have different sort of subspecialties who are focused on their own task. And usually if there's anything that you could do, they would prefer to do it. So in here, we have much more freedom, much more openness with it. You get to do things that in other family medicine residencies, you probably will not, most likely, but here you get that opportunity.
I think a couple things that this program has that makes you a better physician is one, learning how to provide care in the under-resourced area. Sometimes we don't have specialty pediatrics, so when you're in the ED, you have to figure it out on your own without the help of a specialist, or you have to call a telemedicine specialist over the phone to figure out what to do for a certain case.
The whole idea of friendship and partnership came from the idea of people on the same boat and being in the same sort of task. And that's exactly the type of thing it is here. We're on the same ship, we're on the same goal, and we're helping each other up in different aspects of it. And I think that's the best part of it, not just the fact that we're, let's say, just learning to become doctors, but the fact that we have people who are much more learned and experienced. Just like in a ship, we have different parts, different people, yet everyone's helping each other out.
A couple things that I love about doing residency here is one, location. It is a rural area, but it's one of the most beautiful places that I know. We've got ocean, we've got hiking, we've got a lot of arts and culture here too. Then the other thing is the unopposed program, giving you lots of opportunities to work one-on-one with attendings. And I think a lot of people know that family medicine in a rural areas can be a really rewarding career path to take. Number one, preventative medicine I think is more effective than kind of a reactionary medicine. In rural areas is where they need family medicine doctors, and it's where we can make a lot of impact. So come on out and we'll help change the health of our country.